Your Majesties, Your Excellencies, honorable traditional leaders in the House, may I write on the protocol that has been established and say good morning to you all. Good morning. I do have a presentation. If our media team can please beam. I think it would be nice for you to see how we have panned as a country when it comes to the HIV epidemic in Eswatini. I just want to take you briefly to where we are currently in terms of our statistics. Next slide, please. Who's moving the slides for me? Next one. Next. Thank you very much. So we are amongst one of the countries with the highest prevalence of people living with HIV. And our current statistics, in a population of about 1.2 million, we have 215,527 people living with HIV. When we look at the number of people who are getting new infections every year, it's around about 4,000 people. And looking at people who have died due to conditions related to having HIV, AIDS in particular, we were at about 50%. And this is data that we recorded in 2021. We are in the process of generating new data to give us the current status of the epidemic in Eswatini. With the high prevalence, we have worked very hard, and we were amongst the first few countries in the world to achieve the UNAIDS global targets of 95, 95, 95, meaning that 95% of the population already know their HIV status. 95% of the people who are HIV positive are on treatment, and 95% of the people on treatment are virally suppressed. When you are virally suppressed, you are no longer transmitting the virus, meaning that you are protecting infecting other new people. So Eswatini is currently standing at 94, 97, and 96 in terms of those 395. We have done very well. But it is not a time for us to be complacent, because those new infections that we are seeing are still worrying. And when we look at our data, we do realize that these are young people in our population, our future people in the country. So we are strengthening our interventions to make sure that we also find those young people, we educate them, we create awareness, and we make sure that they are quickly linked to treatment. How we managed to achieve the global goals is that in 2016 as a country, we adopted the test and start strategy. So as soon as you got your result as positive for HIV, you were linked and initiated to treatment. Next slide, please. And further looking at our population, as I have said, we have a high number of young people who are HIV positive. We have also seen that amongst our women, they are the ones who are mostly affected, our adolescent girls and young women. And when we look at their counterparts, the males, the prevalence of HIV is not that high. When we get to the age of 50, it is sort of similar between women and women, between men and women in terms of the prevalence. However, when we look at our males above the age of 50, we do realize that they tend to be positive. More of them are positive compared to the women in that age bracket. And what is that telling us as a country? Speculation, there is intergenerational sex. Maybe our young girls and young women are vulnerable due to various reasons, including poverty, lack of knowledge, and they tend to then have relationships with older men who have self-actualized and they are financially stable. Next slide. We are very much grateful of the donor support and the domestic finances that have been put to fight the HIV and AIDS in the country. When we look at the late 1980s, we see that our life expectancy was 62. When the HIV hit hard, our life expectancy reduced to 44 years, and currently we are at 64 years. We are very much happy about that. And when we project and look forward, we want to make sure that we keep our people healthy, and the life expectancy stays as high as it is or even better than where we are now. Next slide. The drivers of the new infections, as I have said, it's low knowledge on HIV and AIDS, which is why we are strengthening our interventions to promote awareness and education, particularly amongst our vulnerable population, which I have said are our adolescent and young people, women in particular. I've also touched a bit on poverty and unemployment, which results in intergenerational sex, and we are strengthening our interventions there. Low availability of condoms as well, with the withdrawal of some funding, external funding. We are, as a country, strengthening the efforts to make sure that we have condoms circulating so that our young people have access to that. We also are rolling out the treatment prevention in the form of oral treatment and injections. And what we are promoting is combination prevention. Because if you take the PrEP, the ARVs to prevent getting new infections, you still are very much prone to getting sexually transmitted infections as well as unplanned pregnancies if you're not using the condom. So this is the information we are taking to our young people, but most importantly, we are strengthening our cultural values. In our culture, a young girl, a young boy is not supposed to engage in sexual relationships until they get married. So we are saying to our young people, let us go back to the ABC. Abstain, preserve your youthfulness until you get married. If you are failing to abstain and you're starting to engage, we are saying be faithful to that one partner that you have chosen. And when you are faithful to that partner that you have chosen, also make sure that you are using the condoms so that you protect yourself from HIV and unwanted pregnancies. Next slide. Also, we are seeing that our young people have early sexual debut. They are starting to engage in sexual activities younger than maybe the rest of us in the room started. So this is where we're also strengthening our educational programs. I've touched on the transitional sex. Also, circumcision for the males is not a culture that we commonly practice, but we are promoting that because evidence shows that it doesn't completely protect one, but it reduces the chances of getting a new HIV infections. We also are seeing gender-based violence in the rise in the country, and we see it as one of the factors which is underlying in causing high incidence of HIV. Our interventions are targeting those areas as well to make sure that we empower our men, we empower our women, we catch them while they are young to teach our young men that you do not fight to get what you want in life. We also teach our girls, and we're empowering them to say that if I say no, my no means no. I do not want to engage in whatever activity maybe the person will be enticing me to engage in. When we look at where we come from in terms of our national strategic framework, leading to 2022, we were focusing on the last mile of ending HIV and AIDS as a public health threat in Eswatini. And as I have said, we have made very good progress. And I want to say that we managed to do this because we work very closely with our traditional structures. We don't wait for our people to go to a hospital or to a clinic, but we are in the communities, in the 59 Tingundlas of the country. We are sending these messages. We are educating our people, and we are saying, do test and know your HIV status, and once you have tested, definitely, you go to the clinic or to the hospital to be initiated on treatment. And as we look forward to 2030 and beyond, our focus is on sustaining these gains that I have talked about and the impact of the HIV response in the country, and also bridging the gaps that I have highlighted as existing gaps in Eswatini. And that is how, as NERCHA, we came into being, because the country realized that HIV is not just a health issue, But it is a multi-sectoral issue that we need to have everybody, all hands on deck to make sure that we win the battle. So as NERCHA, we are working with the Ministry of Tingundla and Administration, with the Deputy Prime Minister's Office for Social Welfare Issues, with the Youth and Cultural Affairs Ministry, so that we are able to reach these young people that I said we have sort of left behind. And we are also working with the Ministry of Health to make sure that once the people have tested positive, they are quickly linked to care and they are monitored for viral suppressions. So our targets for the next couple of years up to 2028, which is our strategic framework, we want to reduce new infections amongst our young people. We want to reduce the infections, particularly amongst our women and young girls who I have said are more vulnerable to getting new infections of HIV. And also we want to reduce transmission of infection from mothers to children, as well as reduce AIDS-related death. In 2023, they were at 55%. By 2028, failing to reach zero, at a minimum, we must be at 30%. So we have 5 priorities that we are following to make sure that we reach the targets that we have set for ourselves as a country. And as I have said, the multi-sectoral response is very much important. My second last slide sort of shows where this one shows the multi-sectoral work that we are doing in the country. And the traditional leaders are very much important. As I have said, that most of the work is happening in the communities. We were very much happy to be invited to speak to you today, because we know that the messages that we have, sharing how we have won the fight in Eswatini and still are pushing to make sure that we have an AIDS-free generation, we have used the structures that are present in this room. I thank you very much for your attention.
Thank you very much, the doctor and Brother Caesar. This is a very important space for us today because while we say that Eswatini has the highest prevalence in the world, we know that actually when you look at the population, because this is just generic, South Africa bypasses because they have a higher population. So these are some of the things which statistics can confuse you about, but we know that this is a small population and we must do everything that needs to be done to protect the people in this country with 1.3 million. I would like to say that stemming from this presentation, we look forward to the traditional leaders maybe coming up with a network to support the work that my mandate is doing in protecting people living with HIV and AIDS in Africa. And because all of us are here, traditional leaders from Africa, I'll hand it over to the King to see if we have this willingness moving forward from now. I thank you.
Definitely, on behalf of the traditional leaders here and those who are not here, I stand to say that yes, of course, we can only but agree with you, accept to forward the cause of preventing HIV, AIDS from ravaging our youths, because that is the future. And so therefore, I stand to say that we, traditional leaders of Africa in our various communities, should be, as has been suggested, that we are the entry point. Yes, we should be the drivers of driving away this pandemic that is destroying our youths, our future, through irresponsible sexual behaviors and transmission from mother to child. I want to commend the work that has been done. First of all, the very brilliant paper that has been delivered here. Our attention has been drawn here again. If need has to be said that we have to be very careful. Africa is rising in all the fronts, and not everyone is happy that Africa is going to take its place. The world used to belong to His Majesty's kingdom, which was London then, England, and then it has moved to the US, America, as the other first choice amongst the continents, the 5 continents. And gradually it is slipping away. All of us are seeing how it is moving to China. And we are just licking our tongues, knowing that Africa's role is in the making. We are going to get there. It will be Africa in some time to come. We may not be there, but Africa will take its own turn because God doesn't cheat. And so therefore, those who are aware of this are working towards not having this happen. That's why you have all kinds of scotches, that Ebola, HIV, AIDS, and all what Ambassador Wallace mentioned yesterday, that there's some work going on trying to depopulate Africa. And we have to be very vigilant. Those of us at the front line, we want to take our seats. We may not be the driver's seat, but we want to be the next person, the conductor to the driver, alongside our politicians who may be insisting to be on the driver's side. This is why this session, this conference, is very important for us traditional leaders, because we want to take our place and direct our people the way that we want, the way that Africa should gain its own place, and not the way that the Europeans or the colonialists have divided us and want us to be. So therefore, as drivers, we will be able to set up here committees. First of all, I have made agreed that we'll be at the forefront of driving this HIV pandemic away from our communities. And right away, we'll put up formal networks to support the right of people living with HIV within our communities, so that they work with the commissioner. We heard here that Dr. Lita she's a twin mother as far as AIDS is concerned, while she takes care of the indigenous and people whose rights are being not clearly seen. She's also there as the HIV commissioner at the level of the African Union, and that's why we have this team here sensitizing us that we have to sit up. I am saying that we will form formal networks. Of course, we have to initiate it here in Eswatini. By the time we close today, we will invite our traditional leaders to come up with a network that would partner with the National AIDS HIV committee or commission or network here. And we, in our own various traditional settings, I'm calling on traditional leaders here and beyond, we should be able to set up the same kind of formal network of prevention and support for people who are HIV AIDS infected within our community, to be able to